Hello, future nurses. We're excited to bring you something that could completely transform your NCLEX preparation. Starting today, we're launching our daily NCLEX practice series. In each video, we'll break down 75 high-yield NCLEX-style questions, handpicked from topics that have been repeatedly asked in previous exams. By the end of this series, you'll have practiced over 5,000 questions, all with explanations, tips, and strategies to help you pass the NCLEX on your very first try. So all you need to do is watch one video daily, stay consistent, stay focused, and watch your confidence grow day by day. Now let's begin today's practice and take one more step toward becoming a licensed nurse. Let us begin with Question 1, which ties pharmacology with critical lab value interpretation. The nurse is caring for a client who is receiving digoxin. Which laboratory value is the priority for the nurse to monitor? Here are options. A. Potassium, B. Calcium, C. Sodium, D. Phosphorus. The correct answer is A. Potassium. Here is why this matters. Monitoring potassium levels is absolutely crucial for clients on digoxin. Why? Because when potassium levels drop, as in hypokalemia, the risk of digoxin toxicity increases significantly. Both potassium and digoxin compete for the same receptor sites on the sodium-potassium ATPase pump in cardiac cells. So when potassium is low, digoxin binds more easily, which can dangerously increase its effect, leading to complications like life-threatening arrhythmias. That is why potassium is the priority electrolyte to monitor in these patients. Now, moving on to Question 2, which focuses on mental health nursing and therapeutic communication. Question 2. The psychiatric nurse is providing care for a patient who has just calmed down after exhibiting inappropriate behaviors related to bipolar disorder. What is the best approach to help prevent another similar episode? Here are options. A. Offer a sedative to prevent future agitation. B. Assist the client in understanding triggering events or feelings that may have led to the outburst. C. Restrict all external stimuli until the client is stabilized. D. Document the incident and avoid revisiting it to reduce emotional distress. The correct answer is B. Assist the client in understanding triggering events or feelings that may have led to the outburst. Here is the key takeaway. After a behavioral episode, the nurse's role is not just to calm the situation, but to help the client build long-term emotional regulation strategies. Helping the client explore and recognize the triggers that led to the outburst enhances their self-awareness. This kind of reflection empowers the patient to better manage future episodes by developing insight and coping strategies. While sedatives and environmental control may be temporarily useful, therapeutic insight has long-term value. Let us continue with Question 3, which highlights fluid and electrolyte monitoring in pediatric care. The nurse is caring for a pediatric client with a nasogastric tube connected to intermittent suction. Which condition should the nurse monitor for as a potential complication? Here are the options. A. Hyponatremia. B. Metabolic acidosis. C. Hyperkalemia. D. Hypercalcemia. The correct answer, A. Hyponatremia. Here is what you need to remember. Nasogastric suction removes not only gastric contents, but also important electrolytes like sodium and potassium. Gastric secretions contain a high amount of sodium, and when they are lost through suctioning, the client is at risk for developing hyponatremia, which is a low sodium level in the blood. This is particularly important in pediatric clients who have a lower overall fluid volume and are more sensitive to shifts in electrolytes. Now, shifting gears to Question 4, which focuses on patient education regarding corticosteroid use. The nurse is caring for a client who was prescribed prednisone. At what time should the nurse instruct the client to take this medication? Here are the options. A. In the morning. B. Around noon. C. Before bed. D. Anytime, but at the same time every day. The correct option is A. In the morning. Here is why timing matters. Prednisone is a corticosteroid that should ideally be taken in the morning, preferably before 9 a.m. This is because it mimics the body's natural circadian release of cortisol, which peaks early in the day. Taking prednisone in the morning helps reduce the risk of insomnia and other sleep disturbances that can occur when corticosteroids are taken later in the day. This small timing detail can make a big difference in minimizing side effects. Before we move to the next question, we want to let you know that you can also enroll in our online NCLEX Review Crash course, designed to help you pass the NCLEX on your very first try. More than 100,000 nurses have already passed the NCLEX through this course, and thousands of new nurses enroll every single month and move one step closer to their dream. Now it's your turn. Enroll today so you're not left behind. Here's what you'll get. Live classes, 100 hours of animated crash course, 500 hours of recorded lectures, more than 5,000 NCLEX-style questions with detailed explanations, mock tests, full study planners, and expert guidance throughout. Plus, you'll get 70% off if you enroll now. The link is in the description box. Don't miss this opportunity. Let us now move on to question 5, which brings in medication calculation, a key skill for every NCLEX nurse. The healthcare provider prescribes cefdinir 25 milligrams per kilogram per day to be given in divided doses every 6 hours. The infant weighs 8 kilograms. How many milligrams should the nurse administer per dose? Here are the options. This is a calculation-based question, so the answer is direct. The correct option is 50 milligrams. Here's how to solve it step by step. First, calculate the total daily dose by multiplying the dose per kilogram by the infant's weight. 25 milligrams multiplied by 8 kilograms equals 200 milligrams per day. Now, since the order is for the medication to be given every 6 hours, that means the total daily dose will be divided into 4 doses. 200 milligrams divided by 4 equals 50 milligrams per dose. So, the correct dosage per administration is 50 milligrams every 6 hours. Always break it down to avoid dosing errors, especially in pediatric clients. Moving ahead, let us now take a look at question 6, which tests your knowledge of vascular disorders, specifically Raynaud phenomenon. The nurse is assessing a client with suspected Raynaud phenomenon or disease. Which of the following findings would support this diagnosis? Here are the options. A. Unilateral swelling of the leg. B. Painful vasospasms. C. Crepitus of the joints. D. Claudication in feet and lower extremities. The correct option is B. Painful vasospasms. Here is the key clinical clue. Raynaud phenomenon presents as painful vasospasms, typically in the fingers and toes, often triggered by cold temperatures or emotional stress. These spasms cause the small arteries to narrow temporarily, limiting blood flow and resulting in a color change pattern: white, lack of blood flow, then blue, cyanosis, and finally red, reperfusion. This condition is often linked to autoimmune disorders like systemic lupus erythematosus or scleroderma. The other options do not align with Raynaud's pathophysiology. Unilateral swelling, joint crepitus, or lower limb claudication suggest different diagnoses. Now, let us transition into question number 7, which focuses on obstetric history documentation using the GTPAL system, an important concept in maternity nursing. The nurse is collecting an obstetric history from a client who has a confirmed current pregnancy and is attending her first prenatal visit. The client reports giving birth to twins 6 years ago at 39 weeks of gestation. She also experienced an ectopic pregnancy at 4 weeks of gestation, which occurred 16 weeks ago. Based on this information, how should the nurse document the client's GTPAL? Here are the options. Option A, gravida is 3, term is 1, preterm is 0, abortions is 1, living is 2. Option B, gravida is 3, term is 2, preterm is 0, abortions is 1, living is 2. Option C, gravida is 4, term is 2, preterm is 0, abortions is 1, living is 2. Option D, gravida is 3, term is 2, preterm is 0, abortions is 1, living is 1. The correct option is option A. Gravida is 3, term is 1, preterm is 0, abortions is 1, living is 2. Let us break this down clearly. G stands for gravida, which means the number of times a woman has been pregnant. This client is currently pregnant, had 1 previous term pregnancy with twins, and 1 prior ectopic pregnancy. That gives us a total of 3 pregnancies, so gravida is 3. T stands for term births. Since the twins were born at 39 weeks, that counts as 1 term delivery, so term is 1. P stands for preterm births, and there were none between 20 and 37 weeks. So preterm is 0. A stands for abortions. This includes any pregnancy losses before 20 weeks. Since the ectopic pregnancy ended early, abortions is 1. L stands for living children. There are 2 living children from the twin birth, so living is 2. Let us now explore question 8, which focuses on post-procedure care for a dermatologic intervention. A nurse is caring for a client who has just returned from undergoing a circular punch skin biopsy to evaluate a suspected case of skin cancer. When assessing the client post-procedure, which findings should the nurse prioritize monitoring at the biopsy site? Here are the options. A. Dehiscence. B. Infection. C. Bleeding. D. Swelling. The correct option is C. Bleeding. Here is why bleeding takes priority. Punch biopsies involve removing a cylindrical piece of skin, often 1 to 10 millimeters in size, using a sharp, circular blade. The most immediate concern after the procedure is bleeding from the site, especially if the area is vascular or not properly compressed. While infection and swelling may occur later, bleeding is the priority to assess and manage right after the procedure to prevent further complications and support proper healing. Let us transition now to question 9, which centers around a commonly prescribed sleep aid, zolpidem. The nurse is caring for a client newly prescribed zolpidem. For which condition is this medication primarily indicated? Here are the options. A. Attention deficit, hyperactivity disorder. B. Generalized anxiety disorder. C. Narcolepsy. D. Insomnia. The correct option is D. Insomnia. Here is the key takeaway. Zolpidem is a non-benzodiazepine sedative used primarily for the short-term treatment of insomnia. It works by acting on gamma-aminobutyric acid, GABA, receptors in the central nervous system to promote sleep without significantly affecting deep stages of the sleep cycle. Unlike medications for ADHD or anxiety, zolpidem is not used for daytime symptom control or mood stabilization. It is meant specifically to help initiate and maintain sleep at night. Now let us dive into question 10, which combines genetics with patient education, a frequent NCLEX topic. You are counseling parents preparing for the birth of their first child. The father has sickle cell anemia, and the mother is a carrier of the sickle cell gene. What is the baby's chance of having sickle cell anemia? Here are the options. A. 25%, B. 50%, C. 75%, D. 100%. The correct option is B. 50%. Let us break this down genetically. Sickle cell anemia is inherited in an autosomal recessive pattern. The father has sickle cell disease, SS, and the mother is a carrier, SABIS. When you draw a Punnett square for this genetic combination, 50% of the offspring will have SS, sickle cell anemia, and the other 50% will have SES, sickle cell trait. Therefore, there is a 50% chance that their child will be born with sickle cell anemia. This question is a great reminder of how genetic counseling plays a vital role in prenatal care and family planning. Let us now move on to question number 11, where we evaluate the effectiveness of a commonly prescribed antihypertensive, hydralazine. The nurse is caring for a client receiving hydralazine as prescribed. Which of the following findings indicates a therapeutic response to the hydralazine? Here are the options. Option A, blood pressure is 120 over 70 millimeters of mercury. Option B, pulse is 67 beats per minute. Option C, total cholesterol is 185 milligrams per deciliter. Option D, activated partial thromboplastin time is 45 seconds. The correct option is Option A, blood pressure is 120 over 70 millimeters of mercury. Here is what you need to know. Hydralazine is a direct-acting vasodilator used to manage hypertension. Its main goal is to reduce elevated blood pressure by relaxing arterial smooth muscles. A blood pressure reading of 120 over 70 millimeters of mercury falls within the normal range, indicating the medication is working effectively. The other values listed, such as cholesterol, heart rate, and clotting time, are not directly related to the drug's intended effect. Before we move to the next question, we want to let you know that you can also enroll in our online NCLEX review crash course, designed to help you pass the NCLEX on your very first try. More than 100,000 nurses have already passed the NCLEX through this course, and thousands of new nurses enroll every single month and move one step closer to their dream. Now it's your turn. Enroll today so you're not left behind. Here's what you'll get. Live classes, 100 hours of animated crash course, 500 hours of recorded lectures, more than 5,000 NCLEX-style questions with detailed explanations, mock tests, full study planners, and expert guidance throughout. Plus, you'll get 70% off if you enroll now. The link is in the description box. Don't miss this opportunity. Let us move forward to question 12, which focuses on basic physical assessment, specifically inspection of the nose. Which of the following findings should be documented as normal when assessing a client's nose? Here are the options. A. Nose symmetrical and midline. B. Nose symmetrical with yellow drainage. C. Nose asymmetrical with clear drainage. D. Nose asymmetrical and proportional to facial features. The correct option is A. Nose symmetrical and midline. Here is the rationale. This one is straightforward. During a routine nose assessment, the normal findings include a symmetrical shape, midline alignment, no discharge, and proportionality to other facial features. Option A is the only one that describes a textbook normal result. Any form of drainage, asymmetry, or structural deviation may indicate an underlying pathology and should be further investigated, making symmetry and midline positioning the hallmark of a normal nasal inspection. Now on to question number 13. A dosage calculation that is essential for safe medication administration, especially in critical care settings. A primary healthcare provider orders dopamine at 5 micrograms per kilogram per minute for a client weighing 80.9 kilograms. The dopamine is supplied as 800 milligrams in 500 milliliters of dextrose, 5% in water. How many milliliters per hour should the nurse administer? The correct option is 15 milliliters per hour. Here is how we break it down. First, calculate the total dose per hour by multiplying 5 micrograms times 80.9 kilograms times 60 minutes, which equals 24,270 micrograms per hour. Then convert micrograms to milligrams. 24,270 divided by 1,000 gives us 24.27 milligrams per hour. Now apply the infusion formula. 24.27 divided by 800, then multiplied by 500. That equals 15.16 milliliters per hour. Rounding to the nearest whole number, the nurse should set the pump to deliver 15 milliliters per hour, ensuring accurate and safe drug administration. Let us now turn our attention to question 14, which explores therapeutic communication in a high-anxiety situation. Question 14. The nurse is speaking with a widower who is experiencing insomnia, shortness of breath, extreme anxiety, and a sense of impending doom. Which nurse response is most appropriate? Here are the options. A. Just relax. You're in a safe place now. You have nothing to worry about. B. Has anything happened recently, or is there anything in the past that could have triggered these feelings? C. The medication that I have given you will help decrease these feelings of anxiety. D. Why do you not take some deep breaths to help you calm down? The correct option is B. Has anything happened recently, or is there anything in the past that could have triggered these feelings? Here is what makes this the best choice. This response is open-ended, empathetic, and encourages the client to reflect and express themselves. In situations of anxiety and emotional distress, the nurse should avoid offering false reassurance or making assumptions. Instead, asking about recent or past triggers allows for therapeutic dialogue and builds trust. It shows the nurse is listening, not just reacting, and that is a textbook example of effective therapeutic communication in mental health nursing. Now, let us move on to question 15, which deals with a common pediatric concern, nocturnal enuresis or bedwetting. Question 15. The nurse is counseling parents who are concerned about their child's frequent nocturnal enuresis. Which of the following should the nurse recommend? Here are the options. A. Establish and maintain a voiding diary for the child. B. Discipline the child after each bedwetting episode. C. Apply diapers or pull-ups routinely at night. D. Have the child go to bed with a full bladder. The correct option is A. Establish and maintain a voiding diary for the child. Here is the reasoning. Keeping a voiding diary helps identify patterns, triggers, and timing of urination. It is a non-punitive, helpful strategy that provides valuable data to guide behavioral or medical interventions. Options B and D are not therapeutic and may worsen the child's anxiety or self-esteem. While diapers may reduce cleanup, they do not address the underlying cause. Education and supportive tracking are always first-line steps for managing nocturnal enuresis, making a voiding diary the best recommendation. Next, let us take a look at question 16, which focuses on albumin therapy and its mechanism of action in fluid management. A nurse is educating a client about albumin therapy for hypoalbuminemia. The correct explanation is that albumin primarily works by, here are the options. A. Stimulating the production of red blood cells in the bone marrow. B. increasing the synthesis of clotting factors in the liver. C. Enhancing the oncotic pressure in the blood vessels. D. Decreasing the release of inflammatory cytokines in the body. The correct option is C. Enhancing the oncotic pressure in the blood vessels. This is a critical concept in fluid balance. Albumin is a major plasma protein that maintains oncotic pressure, which helps retain fluid within the intravascular space. In hypoalbuminemia, fluid tends to leak out into tissues, causing edema. By administering albumin intravenously, we raise the protein level and pull fluid back into the blood vessels, improving perfusion and decreasing third spacing. This mechanism is especially useful in liver failure, nephrotic syndrome, or post-surgical recovery, making it a vital tool in fluid resuscitation. Let us now take a look at question 17, which highlights medication safety, especially in clients receiving anticoagulation therapy. The nurse is caring for a client prescribed enoxaparin, which finding in the client's medical history warrants follow-up with the primary healthcare provider. Here are the options. A. Recent spinal injection. B. Diabetes mellitus. C. Osteoarthritis. D. Venous thromboembolism. The correct option is A. Recent spinal injection. Here is why this option is critical. Enoxaparin is a low molecular weight heparin used to prevent or treat blood clots, but it significantly increases the risk of bleeding. A recent spinal injection, such as an epidural or lumbar puncture, creates a vulnerable site in the spine where a hematoma could form. This could compress the spinal cord or nerve roots, leading to permanent neurological injury. Because of this risk, enoxaparin should not be initiated or continued without careful evaluation after any spinal procedure. The other options, such as diabetes or osteoarthritis, do not pose an immediate contraindication to therapy. Now moving on to question 18, which emphasizes lab monitoring for patients on antiarrhythmic drugs like amiodarone. The nurse is preparing to administer amiodarone. Which laboratory test result should the nurse monitor during therapy? Here are the options. A. White blood cell count. B. Serum glucose level. C. Serum uric acid level. D. Thyroid stimulating hormone, TSH level. The correct option is D. Thyroid stimulating hormone, TSH level. Here is the important connection. Amiodarone affects thyroid function because it contains iodine and interferes with the conversion of thyroxine, T4, to triiodothyronine, T3. This can lead to either hypothyroidism or hyperthyroidism during treatment. For this reason, it is vital for the nurse to monitor thyroid stimulating hormone, TSH levels, regularly in clients receiving amiodarone. Changes in thyroid function can affect the heart and metabolism, and they must be addressed promptly to avoid complications. The other lab values listed are not routinely impacted by this specific drug. Before we move to the next question, we want to let you know that you can also enroll in our online NCLEX review crash course, designed to help you pass the NCLEX on your very first try. More than 100,000 nurses have already passed the NCLEX through this course, and thousands of new nurses enroll every single month and move one step closer to their dream. Now it's your turn. Enroll today so you're not left behind. Here's what you'll get. Live classes, 100 hours of animated crash course, 500 hours of recorded lectures, more than 5,000 NCLEX-style questions with detailed explanations, mock tests, full study planners, and expert guidance throughout. Plus, you'll get 70% off if you enroll now. The link is in the description box. Don't miss this opportunity. And now, for question 19, which combines maternal history with cardiovascular assessment during pregnancy. The nurse is taking the history and physical of a woman who has just discovered she is pregnant. The nurse understands that asking about a history of rheumatic fever is primarily related to, here are the options. A. Cardiac stress related to a possible valvular lesion. B. Preventing transmission of this teratogenic condition to her infant. C. Preparing to deliver preventative antibiotics during labor and post-birth. D. Monitoring lung sounds for reoccurrence of the disorder. The correct option is A. Cardiac stress related to a possible valvular lesion. Here is what makes this clinically important. Rheumatic fever, especially when it occurred during childhood or adolescence, can cause permanent damage to heart valves, particularly the mitral valve. During pregnancy, the cardiovascular system is already under increased workload due to blood volume expansion and hormonal changes. If a woman has a history of rheumatic fever, she may be at risk for decompensation if valvular lesions exist. Identifying this history early allows the healthcare team to conduct echocardiographic evaluations, coordinate care with cardiologists, and manage labor and delivery more safely. Let us now take a closer look at question 20, which focuses on client understanding during prenatal testing, specifically the non-stress test. Which of the following statements by the client would require follow-up? Here are the options. A. I cannot have anything to eat 8 hours prior to this test. B. I will have an external monitor across my abdomen. C. A reactive result means my baby is doing well. D. If this test is abnormal, I will need further testing. The correct option is A. I cannot have anything to eat 8 hours prior to this test. Here is the key misunderstanding. A non-stress test is a non-invasive, painless procedure that monitors fetal heart rate in response to fetal movements using external abdominal monitors. There is absolutely no requirement for fasting. In fact, eating before the test may stimulate fetal activity, which improves the chances of obtaining a reactive result. The other statements are correct and reflect accurate understanding. Therefore, the belief that fasting is needed must be corrected through follow-up education. Now, shifting to question 21, which highlights insulin delivery methods, a common topic in diabetes management. The nurse is assisting a client with their newly prescribed insulin pump. Which type of insulin is most commonly used in the pump? Here are the options. A. Rapid-acting. B. Ultra-long-acting insulin. C. Intermediate-acting. D. Long-acting. The correct option is A. Rapid-acting. Here is why this is important. Insulin pumps are designed to closely mimic the pancreas by delivering both a steady basal rate and mealtime boluses. Rapid-acting insulins such as insulin lispro, aspart, or glulisine are ideal for this purpose because they have a quick onset and short duration, allowing for tighter glucose control. Long-acting or intermediate insulins are not used in pumps since their delayed onset and prolonged action cannot accommodate the precise meal-based dosing required. Let us now move into question 22, which tests your clinical judgment in the early postoperative phase. A client is 6 hours postoperative following a below-knee amputation (BKA). During assessment, which findings should prompt the nurse to follow up immediately? Here are the options. A. Restlessness. Blood pressure of 140 over 78 millimeters of mercury. C. Pulse rate of 89 beats per minute. D. Hypoactive bowel sounds in all 4 quadrants. The correct option is A. Restlessness. Here is the clinical red flag. Restlessness, especially in a postoperative patient, can be an early and subtle sign of serious complications like hemorrhage, hypoxia, or even shock. After a major vascular procedure like a BKA, this symptom warrants immediate follow-up. Even if vital signs appear stable, the nurse must act quickly to assess for bleeding, check the surgical site, and notify the provider if needed. Vital signs like blood pressure and pulse may remain normal temporarily, making restlessness a key early warning sign. Let us move into question 23, which focuses on a postoperative respiratory complication, specifically related to chest tube assessment. The nurse is caring for a client with a chest tube inserted for a pneumothorax. During assessment, the nurse feels a crackling sensation beneath the fingertips around the chest tube insertion site. What should the nurse do next? Here are the options. A. Document the finding as expected. B. Clamp the chest tube. C. Notify the primary healthcare provider. D. Apply nasal cannula oxygen. The correct option is C. Notify the primary healthcare provider. Here is what is happening clinically. The crackling sensation felt under the skin is crepitus, caused by subcutaneous emphysema. This occurs when air leaks into the tissue around the insertion site. While it may not always indicate a crisis, it is a potential complication that could worsen if not addressed. The nurse must notify the primary healthcare provider immediately for further evaluation and potential changes in chest tube management. Clamping the tube is never appropriate unless specifically ordered, as it can increase intrathoracic pressure and worsen the condition. Next, let us look at question 24, which involves client teaching about a common urinary analgesic, phenazopyridine. Question 24. The nurse is teaching a client about phenazopyridine. Which instructions should the nurse include regarding the medication's effects on urine? Here are the options. A. The amount of urine you void will increase. B. Your urine will turn orange in color. C. You may notice that your urine is malodorous. D. Concentrated urine is an expected finding. The correct option is B. Your urine will turn orange in color. Here is rationale. This is a classic side effect that clients should be prepared for. Phenazopyridine causes the urine to turn a bright orange or reddish-orange color. This effect is completely harmless but may alarm clients if they are not warned in advance. It can also stain fabrics or contact lenses. Teaching this early prevents unnecessary concern and reinforces the importance of medication education. The other options, such as changes in volume, odor, or urine concentration, are not typical effects of phenazopyridine. Finally, let us review question 25, which covers pharmacological safety in pregnancy, specifically with ondansetron. A pregnant client hospitalized with hyperemesis gravidarum is receiving ondansetron. Which serious side effects should the nurse monitor for during therapy? Here are the options. A. Continued nausea and vomiting. B. Prolonged QT interval. C. Respiratory distress. D. Constipation. The correct option is B. Prolonged QT interval. This is a high-priority safety concern. Although ondansetron is effective for controlling nausea and vomiting, it has the potential to prolong the QT interval on an electrocardiogram. This can predispose the client to life-threatening arrhythmias such as torsades de Pointes. Clients receiving this medication, especially those with electrolyte imbalances, cardiac conditions, or on other QT-prolonging drugs, require ECG monitoring. Constipation and mild nausea may occur but are less serious and not life-threatening. Let us now look at question 26, which focuses on renal diet education, an essential aspect of managing clients on hemodialysis. The nurse is providing dietary education to a client with renal failure who is undergoing hemodialysis. Which menu selection by the client indicates effective teaching? Here are the options. A. Blueberries, cream of wheat, coffee. B. Bacon, banana, orange juice. C. Sausage, eggs, tomato juice. D. Cured pork, grits, kiwi. The correct option is A. Blueberries, cream of wheat, coffee. Here is what makes this meal ideal. Clients on hemodialysis need to follow a low-sodium, low-potassium, and low-phosphorus diet. Blueberries are a low-potassium fruit, cream of wheat is a suitable low-phosphorus cereal, and black coffee in moderation is usually acceptable within fluid limits. In contrast, bacon, bananas, orange juice, sausage, tomato juice, and cured meats are all high in potassium or sodium, making them poor choices for these clients. This question highlights the critical link between diet and renal function. Moving on to question 27. Let us now focus on patient safety with home oxygen therapy, a crucial teaching point for clients with chronic obstructive pulmonary disease. Question 27. The nurse is teaching a client with chronic obstructive pulmonary disease, COPD, who is prescribed home oxygen therapy. Which instruction should be included in the teaching plan to ensure safe oxygen use? Here are the options. A. Keep the oxygen tubing tucked under the bed linens. B. Use petroleum-based products on the face to prevent dryness. C. Avoid smoking while using oxygen. D. Keep the oxygen flow rate at the highest level for optimal benefit. The correct option is C. Avoid smoking while using oxygen. Here is rationale. This is the #1 safety rule for anyone on home oxygen. Never smoke near oxygen. Oxygen itself does not burn, but it fuels combustion, meaning that even a small flame or spark could ignite and lead to serious injury or a house fire. Clients should also avoid candles, gas stoves, and petroleum-based products like Vaseline, which are flammable. Clear and repeated teaching on this topic is essential to prevent devastating accidents in the home setting. Before we move to the next question, we want to let you know that you can also enroll in our online NCLEX review crash course, designed to help you pass the NCLEX on your very first try. More than 100,000 nurses have already passed the NCLEX through this course, and thousands of new nurses enroll every single month and move one step closer to their dream. Now it's your turn. Enroll today so you're not left behind. Here's what you'll get. Live classes, 100 hours of animated crash course, 500 hours of recorded lectures, more than 5,000 NCLEX-style questions with detailed explanations, mock tests, full study planners, and expert guidance throughout. Plus, you'll get 70% off if you enroll now. The link is in the description box. Don't miss this opportunity. Finally, let us move to question 28, which highlights why continuous cardiac monitoring is vital in chronic kidney disease. The nurse is placing a client with chronic kidney disease on a cardiac monitor. What is the primary reason for this intervention? Here are the options. A. Clients with chronic kidney disease are prone to hypertension. B. Hyperkalemia may result in dysrhythmias. C. Cardiac monitoring is necessary to evaluate the need for hemodialysis. D. Clients with chronic kidney disease may experience false episodes of asystole. The correct option is B. Hyperkalemia may result in dysrhythmias. Here is why this is critical. Clients with chronic kidney disease are at high risk for hyperkalemia due to impaired potassium excretion. Elevated potassium levels can severely disrupt cardiac electrical conduction, leading to dysrhythmias such as bradycardia, ventricular fibrillation, or even cardiac arrest. That is why continuous cardiac monitoring is essential to detect life-threatening changes early and intervene promptly with therapies like calcium gluconate, insulin with glucose, or dialysis. This monitoring is about preventing emergencies, not simply evaluating dialysis or recording false readings. Now, let us continue with question 29, which focuses on infant psychosocial development based on Erikson's theory. The nurse is conducting a psychosocial assessment of a 2-month-old infant. According to Erikson's stages of development, which psychosocial stage is appropriate for this age? Here are the options. A. Initiative versus guilt. B. Autonomy versus shame and doubt. C. Trust versus mistrust. D. Industry versus inferiority. The correct option is C. Trust versus mistrust. Here is how Erikson's theory applies. Infants from birth to around 18 months old are navigating the stage of trust versus mistrust. At this developmental stage, consistent, responsive caregiving fosters a sense of trust in the world, helping the child feel safe, secure, and emotionally connected. In contrast, neglect, inconsistent feeding, or unresponsive care may lead to mistrust and emotional insecurity. This stage is foundational. It affects all future emotional and social development. Now shifting to question 30, let us focus on acute chest trauma and how to recognize a life-threatening complication, pneumothorax. A nurse in the emergency department is assessing a client who was struck in the chest with a baseball bat. Which assessment finding is most indicative of a pneumothorax? Here are the options. A. Decreased respiratory rate. B. Diminished breath sounds. C. Presence of a barrel chest. D. A sucking sound at the injury site. The correct option is B. Diminished breath sounds. Here is the key clinical clue. Diminished or absent breath sounds on one side are a hallmark sign of a pneumothorax, especially following blunt trauma. When air escapes into the pleural space, it prevents the lung from expanding, collapsing part or all of it. This impairs ventilation and can become life-threatening if not quickly addressed. While a sucking sound may be heard in open pneumothorax, it is not as consistently present as diminished breath sounds. That is why auscultation findings are critical in the immediate assessment of chest trauma. Let us now move into question 31, which dives into the critical topic of shock stages, a must-know for emergency and ICU nursing. A patient diagnosed with septic shock is exhibiting generalized edema, anasarca, weak peripheral pulses, decreased urine output, reduced level of consciousness, a blood pressure of 88/52 millimeters of mercury, and a heart rate of 160 beats per minute. Based on these findings, the nurse identifies the client is likely in which stage of shock. Here are the options. A. Progressive. B. Compensatory. C. Irreversible. D. Non-progressive. The correct option is A. Progressive. Here is the key clinical takeaway. The progressive stage of shock begins when the body's compensatory mechanisms fail to maintain adequate tissue perfusion. At this point, vital organs start to suffer from hypoxia. Classic signs include hypotension, tachycardia, decreased urine output, altered mental status, and third spacing of fluids, such as generalized edema or anasarca. These findings indicate the patient is in a critical state where rapid and aggressive intervention is necessary to prevent advancement into the irreversible stage of shock, where multiple organ failure becomes imminent and often fatal. Next, let us shift to developmental milestones with question 32, a core topic in pediatric nursing assessments. The nurse is assessing the developmental milestones of a 3-month-old infant. Which of the following behaviors would be considered appropriate for this age? Here are the options. A. Sit without support. B. Creep on hands and knees. C. Follow simple commands. D. Reach for objects. The correct option is D. Reach for objects. Here is rationale. At 3 months, one of the expected motor milestones is reaching for objects. This shows early development of purposeful movement and improving hand-eye coordination. It is a sign that neuromuscular development is progressing appropriately. In contrast, sitting without support typically occurs around 6 months. Creeping usually starts around 9 months. And following simple verbal commands appears closer to 12 to 15 months of age. Knowing these milestones helps nurses identify early signs of developmental delay and intervene when needed. Now, let us move on to Question 33, which addresses safety concerns for clients diagnosed with Meniere's disease, a condition known for sudden, intense vertigo. The nurse is caring for a client diagnosed with Meniere's disease. Which nursing intervention is the highest priority to ensure the client's safety and well-being? Here are the options. A. Discussing treatment options. B. Initiating fall risk precautions. C. Keeping the client calm during an episode. D. Providing education on potential triggers. The correct option is B. Initiating fall risk precautions. Here is rationale. The most urgent concern with Meniere's disease is the unpredictable and severe vertigo that can cause the client to fall suddenly. That is why fall prevention becomes the highest nursing priority. This includes implementing fall risk precautions such as ensuring the environment is clutter-free, assisting during ambulation, keeping the bed in a low position, and possibly using bed alarms or call lights. While teaching and emotional support are valuable, immediate safety interventions are critical to prevent injury during acute episodes. Let us now explore Question 34, which centers on the psychosocial aspects of teenage pregnancy, a sensitive but important topic in community health nursing. The nurse is preparing an educational presentation on teenage pregnancy for a group of high school students. Which of the following points should be included in the presentation? Here are the options. A. There is a low risk of complications in teen pregnancies. B. Teenage pregnancies are often denied or concealed during the early stages. C. Teens are using contraceptives less frequently than in the past. D. Most teenage pregnancies are planned as a form of rebellion. The correct option is B. Teenage pregnancies are often denied or concealed during the early stages. Here is the rationale. What the evidence shows is that adolescents often experience fear, denial, or shock upon discovering they are pregnant. This emotional reaction leads many teens to conceal or delay reporting the pregnancy in its early stages, increasing the risk of inadequate or delayed prenatal care. This lack of timely medical attention can significantly impact both maternal and fetal health outcomes. Therefore, community education must emphasize non-judgmental support and encourage early prenatal care and open communication. Now, transitioning smoothly into Question 35, which builds upon the previous topic, this time focusing on the most appropriate health teaching content. The nurse is preparing to give a health education session about teenage pregnancy to a group of high school students. Which of the following information is most appropriate to include in the session? Here are the options. A. Teen pregnancies are typically free of complications. B. Adolescents often deny or conceal pregnancy during the early stages. C. Use of contraception among teens is consistently declining. D. Most teen pregnancies are intentionally planned as acts of defiance. The correct option is B. Adolescents often deny or conceal pregnancy during the early stages. Here's the rationale. Just like in the previous question, the denial or concealment of pregnancy is a key barrier to early intervention. Many adolescents delay acknowledging or revealing a pregnancy due to fear of stigma, judgment, or family consequences. This often results in late or no prenatal care, which increases health risks. By discussing this pattern during health education, nurses can help reduce stigma, promote early reporting, and encourage healthier outcomes through timely medical and emotional support. The nurse is providing discharge teaching to a pregnant client at 37 weeks gestation. Which of the following statements should the nurse include as an indication to go to the labor and delivery unit? Here are the options. A. Come in when you notice the mucus plug has passed. B. Report to the hospital if you feel increased bladder pressure. C. Go to the hospital if you experience a large gush of fluid from your vagina. D. You should come in if you feel nauseated or begin vomiting. The correct option is C. Go to the hospital if you experience a large gush of fluid from your vagina. Here is the rationale. This is a critical teaching point. A large gush of fluid typically indicates rupture of membranes, ROM, a key sign that labor may be beginning. At 37 weeks or later, ROM requires immediate evaluation in the labor and delivery unit to assess for fetal well-being, risk of umbilical cord prolapse, and to reduce the chance of infection. In contrast, losing the mucus plug, feeling pressure or nausea alone do not demand immediate hospitalization. Let us now move into question 37, which focuses on the emergency management of a congenital heart defect in pediatric clients, specifically tetralogy of Fallot. The nurse is caring for a pediatric client diagnosed with tetralogy of Fallot who has experienced multiple hypercyanotic episodes, also known as TET spells. Which medication does the nurse anticipate the healthcare provider will prescribe to manage these episodes? Here are the options. A. Morphine sulfate. B. Adenosine. C. Diltiazem. D. Atropine sulfate. The correct option is A. Morphine sulfate. Here is the rationale. TET spells are episodes of sudden cyanosis caused by increased right-to-left shunting due to infundibular spasm and tetralogy of Fallot. Morphine sulfate is effective because it calms the child, decreases respiratory effort, and relaxes the infundibular muscle of the right ventricle, thereby reducing the obstruction and improving pulmonary blood flow. This makes morphine the first-line treatment during acute cyanotic episodes. Next, let us switch gears with question 38, which brings us into the world of physiology and sleep regulation. The nurse is discussing biological clocks with a colleague. Which term describes the human body's internal clock that regulates wakefulness and activity patterns over a 24-hour cycle of day and night? Here are the options. A. Rapid eye movement. REM, sleep. B. Circadian rhythm. C. Diurnal rhythm. D. Nocturnal activity. The correct option is B. Circadian rhythm. Here is the rationale. The circadian rhythm is the body's internal 24-hour timekeeping system, regulated by the suprachiasmatic nucleus in the hypothalamus. It responds primarily to light and dark cycles and governs sleep-wake patterns, hormonal secretion, temperature control, and other physiological processes. Disruptions to this rhythm, such as from shift work or jet lag, can cause insomnia, fatigue, and emotional instability, making it vital to both physical and mental health. And now for question 39, which emphasizes therapeutic communication with confused or disoriented clients, an essential skill in geriatric and mental health nursing. A client with a history of confusion has difficulty recalling recent events and becomes disoriented when away from home. Which statement would be the most effective for reality orientation? Here are the options. A. Good morning. Do you remember where you are? B. Hello, my name is Susan Jones, and I'm your nurse for today. C. How are you today? Remember, you're in the hospital. D. Good morning. You're in the hospital. I am your nurse, Susan Jones. The correct option is D. Good morning. You're in the hospital. I am your nurse, Susan Jones. Here's the rationale. This response offers clear, concise, and reassuring information without putting pressure on the client to recall something they may not remember. Asking questions like, "Do you remember?" can increase anxiety and frustration for someone who is confused. Instead, providing simple orientation statements helps the client reestablish awareness of time, place, and people, a technique known as reality orientation, which helps reduce confusion and maintain emotional stability. Before we move to the next question, we want to let you know that you can also enroll in our online NCLEX Review Crash Course, designed to help you pass the NCLEX on your very first try. More than 100,000 nurses have already passed the NCLEX through this course, and thousands of new nurses enroll every single month and move one step closer to their dream. Now it's your turn. Enroll today so you're not left behind. Here's what you'll get: live classes, 100 hours of animated crash course, 500 hours of recorded lectures, more than 5,000 NCLEX-style questions with detailed explanations, mock tests, full study planners, and expert guidance throughout. Plus, you'll get 70% off if you enroll now. The link is in the description box. Don't miss this opportunity. Let us now explore question 40, which focuses on safe medication practices for a client-prescribed antiviral therapy. Question 40. The nurse is teaching a client prescribed acyclovir for newly diagnosed shingles. Which instruction is most important for the nurse to include? Here are the options. A. Take this medication 30 minutes before meals. B. Continue taking the medication until the rash completely resolves. C. If you miss a dose, take it as soon as you remember or with the next scheduled dose. D. Increase your fluid intake while taking this medication. The correct option is D. Increase your fluid intake while taking this medication. Here is the rationale. Acyclovir is an antiviral medication that is primarily excreted through the kidneys. To help prevent nephrotoxicity, it is essential that the client maintain adequate hydration during therapy. The nurse should also educate the client to monitor for signs of renal issues, such as reduced urine output, hematuria, or flank pain. While medication timing and adherence are important, the priority teaching point is fluid intake, which directly impacts drug clearance and safety. Next, let us move into question 41, which addresses a life-saving precaution in clients with gastrointestinal bleeding using specialized equipment. The nurse is caring for a client with a Seng-Steken-Blakemore tube. At the start of the shift, which priority item should the nurse ensure is immediately available at the bedside? Here are the options. A. Trach kit, B. Scissors, C. Obturator, D. Yankauer suction device. The correct option is B. Scissors. Here is the rationale. This is a high-stakes safety measure. Scissors must always be kept at the bedside of a client with a Seng-Steken-Blakemore tube. The tube has inflatable balloons that can shift and obstruct the airway if they rupture or migrate. In such an emergency, the nurse must quickly cut all lumens to deflate the balloons and remove the tube to restore airway patency. This is a critical nursing action that can prevent respiratory arrest. Other options like suction devices or trach kits are useful in general care, but they do not address the specific emergency risk of this device. Finally, let us review question 42, which involves client education on safe administration of ophthalmic medications. The nurse is providing discharge instructions about eye drop medications. Which action should the nurse advise the client to perform to reduce systemic absorption and minimize side effects? Here are the options. A. Instill the eye drops before meals. B. Swallow several times while administering the eye drops. C. Blink rapidly after instilling the eye drops. D. Gently press a finger over the inner corner of the eye, nasolacrimal duct, for 30 to 60 seconds after installation. The correct option is D. Gently press a finger over the inner corner of the eye, nasolacrimal duct, for 30 to 60 seconds after installation. Here is the rationale. This technique is known as punctal occlusion, and it is a key teaching point for reducing systemic absorption of eye medications. By pressing on the nasolacrimal duct, the client prevents the drug from draining into the nasal cavity where it can enter systemic circulation. This is especially important for medications like beta-blocker eye drops used in glaucoma, which can affect heart rate and blood pressure. The other options do not reduce absorption and may even promote unwanted effects. Let us now move into question 43, which focuses on pharmacology, specifically identifying the purpose of a potent antifungal agent. The nurse is reviewing a new prescription for amphotericin B. The nurse recognizes that this medication is used to treat which type of infection? Here are the options. A. Autoimmune infections. B. Fungal infections. C. Viral infections. D. Bacterial infections. The correct option is B. Fungal infections. Here is the rationale. Amphotericin B is one of the most powerful antifungal agents available and is reserved for serious systemic fungal infections, such as histoplasmosis or cryptococcal meningitis. However, it comes with significant side effects, most notably infusion-related reactions like fever, chills, rigors, and nephrotoxicity. To reduce these reactions, clients are often pre-medicated with acetaminophen, diphenhydramine, and isotonic saline. It is critical to monitor renal function and electrolytes closely during therapy. Now let us look at question 44, which involves safety and infection control precautions for a client receiving internal radiation therapy. Question 44. A nurse is assigned to care for a client with an internal radiation implant. The care plan should include all of the following except. Here are the options. A. Wearing gloves when handling the client's bedpan. B. Leaving soiled linens in the used linen bin within the client's room. C. Wearing a lead apron when providing direct care to the client. D. Placing the client in a semi-private room at the end of the hallway. The correct option is D. Placing the client in a semi-private room at the end of the hallway. Here is the rationale. Clients with internal radiation implants must be placed in a private room with limited visitor access to prevent radiation exposure to others. Option D is incorrect and unsafe because a semi-private room places another patient at risk. The correct protocol includes wearing gloves when handling bodily fluids, using lead shielding during direct care, and keeping soiled linens in the room to avoid contaminating other areas. Remember the golden rules of internal radiation safety: time, distance, and shielding. Limit your time with the client, maximize your distance when possible, and always wear appropriate protective gear to reduce radiation exposure. Finally, let us go through question 45, which focuses on the safe administration of anticoagulants at home, a crucial skill for caregivers. The nurse is teaching a caregiver how to administer a pre-filled enoxaparin injection. Which statement made by the caregiver indicates a need for further teaching? Here are the options. A. I will give this injection in the abdomen. B. I should expel the air bubble before giving the injection. C. Green leafy vegetables are allowed while taking this medication. D. This medication may increase the risk of bleeding. The correct option is B. I should expel the air bubble before giving the injection. Here's the rationale. This is an important safety reminder. The small air bubble included in a pre-filled enoxaparin syringe should not be expelled. It ensures the full dose is administered and creates an airlock to help seal the medication in the subcutaneous tissue, minimizing bruising and preventing backflow. In contrast to warfarin, enoxaparin is not affected by vitamin K intake, so foods like green leafy vegetables are allowed. The caregiver correctly identified that bleeding risk is a concern, which is true for all anticoagulants. Reinforcing proper injection technique and addressing common misconceptions helps prevent medication errors and complications in the home setting. Let us revisit question 46, which reinforces safe home administration of anticoagulants, particularly enoxaparin. The nurse is teaching a caregiver how to administer a pre-filled enoxaparin injection. Which statement made by the caregiver indicates a need for further teaching? Here are the options. A. I will give this injection in the abdomen. B. I should expel the air bubble before giving the injection. C. Green leafy vegetables are allowed while taking this medication. D. This medication may increase the risk of bleeding. The correct option is B. I should expel the air bubble before giving the injection. Here is the rationale. This statement is incorrect and needs clarification. Pre-filled enoxaparin syringes contain a small air bubble on purpose. This bubble helps ensure that the full dose is delivered and reduces bruising by creating an airlock when given subcutaneously. It should not be expelled before the injection. The other statements about the injection site, diet, and bleeding risk are accurate and demonstrate appropriate understanding of medication use. Question 47. The nurse is assessing a 1-month-old infant suspected of cardiac arrest. Which pulse site is most appropriate for pulse assessment? Here are the options. A. Brachial. B. Femoral. C. Carotid. D. Popliteal. The correct option is A. Brachial. Here is the rationale. For infants under 1 year of age, the brachial pulse is the most appropriate and reliable site to assess circulation, especially during an emergency like cardiac arrest. It is located on the inside of the upper arm between the shoulder and elbow. This site is more accessible and easier to palpate in infants compared to the carotid or femoral arteries, and is standard for guiding CPR efforts and checking for return of spontaneous circulation. Let's move to question number 48. The nurse is providing discharge teaching to the parents of a newborn diagnosed with hyperbilirubinemia. The nurse emphasizes the importance of monitoring for signs of kernicterus. Which of the following signs or symptoms should the nurse include as indicative of kernicterus? Here are the options. A. Jaundice progressing from the head downward. B. Poor feeding and lethargy. C. Rapid breathing and cyanosis. D. Excessive crying and irritability. The correct option is B. Poor feeding and lethargy. Here is the rationale. Kernicterus is a dangerous neurological complication caused by severe hyperbilirubinemia, in which excess bilirubin crosses the blood-brain barrier and accumulates in brain tissue. The earliest warning signs include lethargy, poor feeding, and decreased responsiveness. If left untreated, it can progress to muscle rigidity, seizures, opisthotonos, severe arching of the neck and back, and even death. While jaundice spreading from head to toe is a typical bilirubin pattern, it does not indicate kernicterus unless accompanied by neurological symptoms, making option B the critical sign to watch for. Before we move to the next question, we want to let you know that you can also enroll in our online NCLEX Review Crash Course, designed to help you pass the NCLEX on your very first try. More than 100,000 nurses have already passed the NCLEX through this course, and thousands of new nurses enroll every single month and move one step closer to their dream. Now it's your turn. Enroll today so you're not left behind. Here's what you'll get. Live classes, 100 hours of animated crash course, 500 hours of recorded lectures, more than 5,000 NCLEX-style questions with detailed explanations, mock tests, full study planners, and expert guidance throughout. Plus, you'll get 70% off if you enroll now. The link is in the description box. Don't miss this opportunity. Let's move to question number 49. A medical surgical nurse receives a report about a client who is legally blind. Which nursing action is most likely to reduce this client's anxiety? Here are the options. A. Assign the client to a private room. B. Orient the client to their room. C. Request a sitter be assigned to the client. Direct the unlicensed assistive personnel to check on the client frequently. The correct option is B. Orient the client to their room. Here is the rationale. Clients who are legally blind may feel disoriented, vulnerable, and anxious in unfamiliar settings. The most effective nursing action to reduce this anxiety is to clearly orient the client to their surroundings using descriptive, directional language. For example, explain where the bed, bathroom, call bell, and furniture are located using a clock face reference. This promotes a sense of familiarity, independence, and control, helping the client feel safer and more confident in navigating the room. While privacy and frequent checks are helpful, orientation provides the most direct support for reducing anxiety. Let's move to question number 50. The nurse is caring for a client newly admitted to the mental health unit with bulimia nervosa. Which client statement requires immediate follow-up and education? Here are the options. A. These sores in my mouth hurt. B. When can I weigh myself? C. I hate my life and wish it was over. D. I feel really dizzy right now. The correct option is D. I feel really dizzy right now. Here's the rationale. In clients with eating disorders such as bulimia nervosa, physical complications often take priority due to the risk of severe electrolyte imbalances. Frequent vomiting or laxative use can lead to dehydration, hypokalemia, or hypotension, which may present as dizziness, a possible indicator of circulatory compromise. Let's move to question number 51. The nurse is caring for a client diagnosed with Guillain-Barré syndrome, GBS, who is experiencing progressive muscle weakness. Which nursing action should be prioritized? Here are the options. A. Assessing respiratory status frequently. B. Administering intravenous immunoglobulin, IVIG, as prescribed. C. Providing passive range of motion exercises to maintain joint mobility. D. Monitoring for autonomic dysreflexia. The correct option is A. Assessing respiratory status frequently. Here is the rationale. Guillain-Barré syndrome is a neurological disorder that causes ascending paralysis, which may impair respiratory muscles. Because respiratory failure is the most life-threatening complication of GBS, the priority nursing intervention is frequent respiratory assessment, including rate, depth, oxygen saturation, and signs of fatigue. Early detection of respiratory compromise allows for prompt intubation or ventilatory support if needed. While IVIG is part of treatment, airway and breathing always come first. Let's move to question number 52. The nurse is changing the diaper of an 8-month-old infant suspected of having celiac disease. The nurse notices the stool is large, pale, oily, and malodorous. How should the nurse document this type of stool? Here are the options. A. Diarrhea. B. Steatorrhea. C. Hematochezia. D. Melena. The correct option is B. Steatorrhea. Here is the rationale. Steatorrhea refers to fatty stools, often seen in conditions involving malabsorption, such as celiac disease. These stools are typically pale, bulky, greasy, and foul-smelling, and may float in the toilet due to high fat content. It differs from diarrhea, which is watery but not fatty, and from hematochezia, bright red blood from the rectum, or melena, black, tarry stools from upper gastrointestinal bleeding. Recognizing steatorrhea is essential for diagnosing and managing nutritional deficiencies in malabsorptive disorders. Let's move to question number 53. The nurse is preparing to wean a client from mechanical ventilation. Before proceeding, which clinical assessment data should the nurse prioritize reviewing to determine the client's readiness for weaning? Here are the options. A. Chest X-ray. B. Sputum culture. C. Lung sounds. D. Arterial blood gas, ABG. The correct option is D. Arterial blood gas, ABG. Here's the rationale. Arterial blood gas analysis provides the most objective data on a client's oxygenation, PaO2, ventilation, PaCO2, and acid-base balance, pH, all critical components to determine whether the client can breathe effectively without ventilator support. If these values are within acceptable ranges, the client may be ready to initiate the weaning process. Although chest X-rays and lung sounds offer supportive information, they do not directly measure gas exchange, which is the key to safe weaning. Sputum cultures are important for infection control but are not used to assess weaning readiness. Let's move to question number 54. After receiving the night shift report, the nurse prepares to prioritize newborn assessments. Which of the following newborns should the nurse assess first? Here are the options. A. A 3-hour-old newborn weighing 6 pounds. B. A 4-hour-old newborn delivered at 42 weeks. C. A 6-hour-old newborn that is 21 inches long. D. An 8-hour-old newborn delivered at 40 weeks. The correct option is B. A 4-hour-old newborn delivered at 42 weeks. Here is the rationale. A newborn delivered at or beyond 42 weeks of gestation is considered post-term, which increases the risk of placental insufficiency, meconium aspiration syndrome, hypoglycemia, and hypothermia. These infants often have decreased subcutaneous fat and may show signs of distress earlier than full-term infants. Therefore, the post-term newborn should be assessed first to ensure there are no signs of respiratory distress or glucose instability. The other newborns may require routine monitoring, but do not carry the same level of risk as the post-term infant. Let's move to question number 55. A nurse supervises a new graduate caring for a child immediately after surgery to correct an imperforate anus, anorectal malformation. Which action by the new graduate requires immediate follow-up? Here are the options. A. Positions the child in a side-lying prone position with hips elevated. B. Obtains a rectal temperature. C. Auscultates bowel sounds in all 4 abdominal quadrants. D. Secures the indwelling urinary catheter bag to the frame of the bed. The correct option is B. Obtains a rectal temperature. Here is the rationale. Following surgical correction of an imperforate anus, the surgical site is extremely fragile. Inserting anything rectally, including a thermometer, can damage sutures, introduce infection, or disrupt healing. Rectal temperature assessments are strictly contraindicated post-operatively in these cases. The other actions, such as positioning to reduce pressure, monitoring bowel function, and safely securing catheters, are appropriate and should be continued. Let's move to question number 56. The nurse is conducting a follow-up assessment on an adolescent recently started on guanfacine. Which finding best indicates the medication is effective? Here are the options. A. Euthymic mood. B. Reduced social anxiety. C. Improved academic performance. D. Absence of suicidal thoughts. The correct option is C. Improved academic performance. Here is the rationale. Guanfacine is an alpha-2 adrenergic agonist used to treat attention deficit hyperactivity disorder, ADHD. It works by improving focus, attention span, and impulse control, particularly in adolescents. The best way to assess its effectiveness is by noting objective improvements in areas like academic performance, as individuals with ADHD often struggle with school-related tasks. While mood and anxiety are important to assess, they do not directly reflect guanfacine's primary therapeutic goal for ADHD. Let's move to question number 57. A registered nurse, also known as RN, is supervising a licensed practical nurse or vocational nurse, referred to as LPN or VN. Which statement by the LPN or VN requires immediate follow-up by the registered nurse? Here are the options. Option A, I bathed the client already this morning. Option B, I handed out letters and packages to the clients this morning. Option C, the client refused his prescribed valproic acid, so I snuck it into his food. Option D, I will be joining the clients with their games today in the day room. The correct option is Option C, the client refused his prescribed valproic acid, so I snuck it into his food. Here's the rationale. This statement reveals a serious legal and ethical violation. Every client, regardless of their mental health status, has the right to refuse medication. Hiding medication in food without consent is considered covert administration and may be classified as battery or abuse. This requires immediate intervention by the supervising registered nurse to ensure client safety, protect patient rights, and report the behavior through the proper chain of command. The other actions may warrant casual discussion, but do not pose an immediate legal or clinical risk. Let's move to question number 58. The nurse is caring for a client who has been prescribed a monoamine oxidase inhibitor, MAOI. The nurse knows this medication is primarily used to treat which condition? Here are the options. A. Personality disorders, B. Major depressive disorder, MDD, C. Schizophrenia, D. Bipolar disorder. The correct option is B. Major depressive disorder, MDD. Here is the rationale. MAOIs are primarily used to treat major depressive disorder, especially in clients with treatment-resistant depression who have not responded to SSRIs or SNRIs. These medications work by inhibiting the enzyme monoamine oxidase, which increases the availability of serotonin, norepinephrine, and dopamine. Due to the risk of hypertensive crisis when combined with certain foods or drugs, MAOIs are less commonly prescribed today, but they remain important for specific cases of severe depression. They are not indicated for schizophrenia, bipolar disorder, or personality disorders. Let's move to question number 59. The nurse is calculating the total intake for a client who received the following: 2 100 milliliter intravenous antibiotic infusions, 2 8-ounce cups of ice, 1 8-ounce cup of coffee, 3 8-ounce cups of water. What is the client's total intake in milliliters? Fill in the blank space. The correct answer is 1,400 milliliters. Here's the rationale. To accurately calculate fluid intake, 2 intravenous infusions of 100 milliliters each equals 200 milliliters ice. 2 cups multiplied by 240 milliliters multiplied by 0.5 for melted volume equals 240 milliliters coffee. 1 cup multiplied by 240 milliliters equals 240 milliliters. Water, 3 cups multiplied by 240 milliliters equals 720 milliliters. Total intake is 200 plus 240 plus 240 plus 720, which equals 1,400 milliliters. Always remember, ice counts as half its volume when calculating intake, since it melts into less liquid. Before we move to the next question, we want to let you know that you can also enroll in our online NCLEX Review crash course, designed to help you pass the NCLEX on your very first try. More than 100,000 nurses have already passed the NCLEX through this course, and thousands of new nurses enroll every single month and move one step closer to their dream. Now it's your turn. Enroll today so you're not left behind. Here's what you'll get: live classes, 100 hours of animated crash course, 500 hours of recorded lectures, more than 5,000 NCLEX-style questions with detailed explanations, mock tests, full study planners, and expert guidance throughout. Plus, you'll get 70% off if you enroll now. The link is in the description box. Don't miss this opportunity. Let's move to question number 60. The nurse is providing discharge teaching to a client who is alert and oriented, but seems unable to understand the information. The client shows forehead sweating, reports a feeling of impending doom, and has tachycardia. What is the nurse's best assessment of the client's condition? Here are the options: A. Mild anxiety, B. Moderate anxiety, C. Severe anxiety, D. Psychosis. The correct option is C. Severe anxiety. Here is the rationale. In severe anxiety, a client's perceptual field narrows drastically, limiting the ability to process information, learn, or concentrate. Physical symptoms such as sweating and tachycardia may occur in both moderate and severe anxiety, but the inability to comprehend teaching is what distinguishes severe anxiety here. In contrast, a client with moderate anxiety might still be able to focus with redirection. Let's move to question number 61. Question: which of the following is the most common etiology of intracerebral hemorrhagic stroke? Here are the options: A. Medications, B. Hypertension, C. Trauma, D. Arteriovenous malformation, AVM. The correct option is B. Hypertension. Here is the rationale. Chronic uncontrolled hypertension is by far the most common cause of spontaneous intracerebral hemorrhage, ICH. Over time, persistent high blood pressure weakens the walls of small penetrating arteries in the brain, leading to microaneurysms, Charcot-Bouchard aneurysms, that may rupture. This results in bleeding most commonly in areas such as the basal ganglia, thalamus, pons, and cerebellum. Let's move to question number 62. Let us now turn our attention to a high-yield congenital gastrointestinal condition often tested on the NCLEX. Here is the question: which of the following is described as a malformation resulting in narrowing or absence of a portion of the intestine? Options include A. Intestinal atresia, B. Malrotation, C. Volvulus, D. Hirschsprung's disease. Now, let us break this down together. The correct answer is option A, intestinal atresia. Here is why. Intestinal atresia refers to a congenital malformation where part of the intestine is either narrowed or completely absent, causing an obstruction to the normal passage of intestinal contents. It typically presents shortly after birth with symptoms like bilious vomiting, abdominal distension, and failure to pass meconium. Let's move to question number 63. The nurse is assessing a pregnant client in her third trimester and observes multiple bruises in various stages of healing on her arms and upper back. What is the nurse's priority assessment? Here are the options. A. Major depressive disorder. B. Iron deficiency anemia. C. Intimate partner violence. D. Polycythemia vera. The correct option is C. Intimate partner violence. Here is the rationale. This question reinforces the same clinical priority. Multiple bruises in varying stages of healing during pregnancy are a classic sign of physical abuse. The nurse must screen for IPV immediately. IPV can lead to poor maternal outcomes, fetal harm, and even death. This assessment cannot be delayed or ignored, ensuring client safety, making appropriate referrals, and following institutional protocols is the highest priority. Let's move to question number 64. The nurse is providing discharge teaching to a client with a platelet count of 40,000 per microliter. That is 40 times 10 to the power of 9 per liter. Which instruction should the nurse provide? Here are the options. Option A, be sure to take your aspirin with meals daily. Option B, you may continue to shave with a straight edge razor. Option C, use a soft toothbrush and floss gently. Option D, you should take a multivitamin daily. The correct option is option C, use a soft toothbrush and floss gently. Here is the rationale. A platelet count of 40,000 per microliter indicates thrombocytopenia, which puts the client at increased risk for bleeding. The most important intervention is to minimize trauma, especially in the oral cavity where bleeding is common. Clients should use a soft bristled toothbrush and floss gently to prevent gum injuries. Aspirin and straight-edge razors are contraindicated, as they increase the risk of bleeding. Multivitamins are not harmful, but they do not directly address the immediate safety need related to thrombocytopenia. Let's move to question number 65. A nurse manager notices the nursing staff is struggling to provide culturally competent care for clients from diverse backgrounds. What is the most appropriate action for the nurse manager to take? Here are the options. A. Ask staff to research articles about different cultures on their own time. B. Transfer nurses to other units to avoid assignments with culturally diverse clients. C. Rotate nurse assignments to expose all staff to clients from various cultural backgrounds. D. Organize a workshop that provides staff with opportunities to learn about the cultures they will encounter. The correct option is D. Organize a workshop that provides staff with opportunities to learn about the cultures they will encounter. Here is the rationale. Organizing a workshop provides a structured and interactive environment where staff can learn about cultural norms, examine personal biases, and engage in real-life scenarios. This promotes deeper understanding and enhances cultural competence. Simply rotating assignments or expecting staff to do independent research is less effective and inconsistent. Avoiding diverse clients entirely, as in option B, is inappropriate and unethical in healthcare settings that value inclusivity and equity. Let's move to question number 66. When assessing a woman new to the clinic, the nurse notes she is described as nulliparous. What does the term nullipara mean? Here are the options. A. A woman who had one pregnancy loss at 25 weeks with no surviving children. B. A woman who has never given birth to a child. C. A woman who has had 3 prior pregnancies. D. A woman who has never been pregnant. The correct option is B. A woman who has never given birth to a child. Here's the rationale. The term nullipara refers specifically to a woman who has never given birth to a viable infant, meaning she has not carried a pregnancy past 20 weeks gestation, whether the child lived or not. It is different from nulligravida, which describes a woman who has never been pregnant at all. Understanding parity is important in obstetrics, as it affects pregnancy risk assessment and labor planning. Let's move to question number 67. The nurse is talking with parents who are concerned about their toddler's growing independence, expressing a desire to always tend to the child. How should the nurse best address the parents' concerns about their toddler's increasing need for autonomy? Here are the options. A. Your child may develop mistrust if independence is not encouraged. B. Your child may develop shame if independence is not supported. C. Your child may feel guilt if independence is discouraged. D. Your child may feel inferior if independence is withheld. The correct option is B. Your child may develop shame if independence is not supported. Here is the rationale. According to Erikson's psychosocial development theory, toddlers are in the stage of autonomy versus shame and doubt. Encouraging independence during this time helps children develop self-confidence, decision-making, and control over bodily functions. When caregivers overprotect or limit autonomy, toddlers may develop feelings of shame or self-doubt, potentially impairing future self-esteem and problem-solving skills. Let's move to question number 68. A client with chronic obstructive pulmonary disease, COPD, is prescribed ipratropium bromide inhalation therapy. The nurse understands that the primary therapeutic effect of ipratropium is, here are the options. A. Dilate coronary arteries. B. Inhibit histamine release. C. Relax bronchial smooth muscle. D. Block muscarinic receptors. The correct option is C. Relax bronchial smooth muscle. Here is the rationale. Ipratropium bromide is an anticholinergic bronchodilator that works by relaxing the bronchial smooth muscles, making it easier for air to pass through narrowed airways. This action helps relieve bronchospasm, particularly in clients with COPD and sometimes in asthma. While ipratropium technically blocks muscarinic receptors to achieve its effect, the therapeutic goal of the drug is bronchodilation, not direct muscarinic blockade as a primary outcome. That is why option C best reflects the drug's clinical intent. Let's move to question number 69. A nurse is caring for a client diagnosed with Lyme disease. Which medication should the nurse expect to be prescribed? Here are the options. A. Finasteride. B. Doxycycline. C. Valacyclovir. D. Diphenhydramine. The correct option is B. Doxycycline. Here is the rationale. Doxycycline is a tetracycline-class antibiotic that is the first-line treatment for early Lyme disease, which is caused by Borrelia burgdorferi following a tick bite. It is effective in treating both localized and early disseminated infections. The other options are not appropriate. Finasteride is used for benign prostatic hyperplasia, valacyclovir is an antiviral for herpes viruses, and diphenhydramine is an antihistamine used for allergies, not infections. Let's move to question number 70. Select the correctly paired classification of cultural health beliefs and its example. Here are the options. A. Holistic health beliefs. Illness results from a pathogen causing infection. B. Magical health beliefs. Illness results from disharmony between the body and mind. C. Scientific health beliefs. Wearing an amulet to protect health. D. Scientific health beliefs. Compliance with the prescribed medical regimen is essential for health. The correct option is D. Scientific health beliefs. Compliance with the prescribed medical regimen is essential for health. Here is the rationale. Scientific or biomedical health beliefs are grounded in evidence-based medicine and logic, where illness is thought to have a biological cause, and treatment is based on scientific intervention. Following prescribed treatments, taking medications, and undergoing diagnostic tests are all hallmarks of this belief system. The other options mix up belief systems. Holistic focuses on balance of body, mind, and spirit. Magical involves supernatural forces, and wearing amulets falls under folk or magical belief systems, not scientific reasoning. Let's move to question number 71. A nurse is caring for a client who just returned from an endoscopy procedure. Before allowing the client to resume eating or drinking, what is the priority action the nurse should take? Here are the options. A. Assess the client's oxygen saturation level. B. Assess for the return of the client's gag reflex. C. Have the healthcare provider discuss the procedure results with the client. D. Start the client on a soft diet to test tolerance. The correct option is B. Assess for the return of the client's gag reflex. Here's the rationale. Endoscopy procedures often involve sedation and topical anesthetics, which can temporarily suppress the gag reflex. Before permitting any oral intake, the nurse must ensure the gag reflex has returned to prevent aspiration and airway compromise. This is a safety priority and should be done before checking results or initiating any oral intake. The other options are appropriate, but do not come before ensuring the gag reflex is intact. Let's move to question number 72. A nurse is caring for a client who fell from a ladder and reports numbness in the lower extremities. What is the nurse's initial priority action? Here are the options. A. Assess the client for lacerations. B. Evaluate the range of motion of the client's neck. C. Provide cervical spine stabilization. D. Assess the client's range of motion in the lower extremities. The correct option is C. Provide cervical spine stabilization. Here is the rationale. Any client who has experienced trauma and reports numbness or weakness is at risk for spinal cord injury. The nurse's first action should always be to immobilize the cervical spine to prevent any further neurologic damage. Moving the client's head or limbs without stabilization can cause irreversible injury. Assessing range of motion or for lacerations comes after stabilization. This is a classic airway breathing circulation spine safety sequence in trauma care. Before we move to the next question, we want to let you know that you can also enroll in our online NCLEX review crash course, designed to help you pass the NCLEX on your very first try. More than 100,000 nurses have already passed the NCLEX through this course, and thousands of new nurses enroll every single month and move one step closer to their dream. Now it's your turn. Enroll today so you're not left behind. Here's what you'll get: live classes, 100 hours of animated crash course, 500 hours of recorded lectures, more than 5,000 NCLEX-style questions with detailed explanations, mock tests, full study planners, and expert guidance throughout. Plus, you'll get 70% off if you enroll now. The link is in the description box. Don't miss this opportunity. Let's move to question number 73. The nurse is caring for a client who is receiving a prescribed dose of sumatriptan for migraine relief. During the assessment, the client reports a new symptom. Which client report should alert the nurse to a potential adverse reaction to sumatriptan? Here are the options. A. Nervousness. B. Warm sensation. C. Angina. D. Tingling sensation. The correct option is C. Angina. Here is the rationale. Sumatriptan is a serotonin receptor agonist used to relieve migraines by causing vasoconstriction of cranial blood vessels. However, this vasoconstrictive action can also affect coronary arteries, potentially causing angina or chest pain, particularly in clients with underlying cardiovascular disease. While tingling and flushing are common and benign side effects, angina requires immediate medical attention, as it can be a precursor to myocardial ischemia or infarction. Let us now explore a high-yield neurology question that focuses on diabetes-related cranial nerve complications. Question number 74. What is the most common cranial mononeuropathy in diabetic patients? Here are the options. A. Bell's palsy. B. Cranial mononeuropathy. C. Third nerve palsy. D. Auditory neuropathy. The correct option is C. Third nerve palsy. Here is the rationale. In diabetic patients, third nerve palsy, also known as oculomotor nerve palsy, is the most common cranial mononeuropathy. It typically presents with ptosis, drooping eyelid, diplopia, double vision, and eye deviation down and out, while importantly sparing the pupil, a key distinguishing feature from compressive causes like aneurysms. The reason it spares the pupil is because the superficial parasympathetic fibers controlling pupillary constriction are usually unaffected in ischemic, diabetic, third nerve palsy. Let us now move on to another essential neurology question. This one focusing on stroke pathophysiology and vascular anatomy. Question number 75. Which artery is most commonly involved in ischemic stroke? Here are the options. A. The posterior inferior cerebellar arteries. B. The middle cerebral artery. C. The anterior cerebral artery. D. The posterior cerebral artery. The correct option is B. The middle cerebral artery. Here is the rationale. The middle cerebral artery, MCA, is by far the most commonly affected artery in ischemic strokes. It supplies a large portion of the lateral cerebral cortex, including areas responsible for motor and sensory control of the face and upper extremities, as well as Broca's and Wernicke's language areas in the dominant hemisphere. Occlusion of the MCA often results in contralateral hemiparesis and sensory loss, face and arm more than leg, aphasia if the dominant hemisphere is involved, or hemineglect if the non-dominant hemisphere is involved. Great work today. Keep practicing daily to stay on track for NCLEX success. Don't forget to join us tomorrow for the next 75 questions. And if you want full access to our crash course, check the link in the description. See you in the next video. Stay focused and keep going.